Hi everyone, I'm Dr. Freddie Gomez, and thank you for joining us today on The Doctor is In. The world is on a hunt for a COVID 19 vaccine, and there are several clinical trials being conducted to find possible treatments. But while there's no working vaccine yet, it's important to keep ourselves and the people around us protected. Today, we will discuss these clinical trials and the safety measures we should practice as we await the vaccine. With us today is Dr. Ong-Lim. She's a pediatric infectious disease specialist from UP-PGH and a member of the Health Professional Alliance Against COVID-19. Thanks for joining us, Dr. Anna.
Hi, thank you for inviting me.
Doctor, it's important to understand these clinical trials. Let's first discuss what is the purpose of a vaccine clinical trial. Bakit kailangan na may clinical trial muna? Bakit hindi pwedeng once na merong nakitang cure, possible cure, pwedeng ibigay na kagad dun sa mga apektado ng COVID-19?
So, Doc Freddy, I think we need to clarify some terms, no? So, unang-una, ang bakuna kasi, it's meant to prevent the disease. And ang target nating pagbigyan nito ay yung mga hindi pa nahahawaan, hindi pa nagkakasakit. And that's also precisely the reason why gusto nating maging maingat. Kasi eto na ngang tao na lumalapit para makaiwas sa sakit, tapos yun pang ibibigay natin ang siyang magiging cause or makakasama dun sa pagkakasakit niya, syempre hindi yan acceptable. No? So therefore, karaniwan pagkabakunang pinag-uusapan, the highest possible standards for safety are really the focus of the investigations.
That's right. So napakaklaro po nun because buhay po ang nakasalalay dito sa mga binibigay po natin. Ano? At marami rin ang nagtataka, Dr. Ana, why does it take so long to create a vaccine, particularly for COVID-19? Ano bang mangyayari kung mamadaliin ang paggamit ng vaccines at hindi na dumaan sa proseso ng mga trials na ito?
So unang-una na lang, Doc Freddy, no? Ngayon pa lang natin inaalam yung detalye tungkol sa sakit na to. We're not really 100% sure about how this disease causes illness and what the process is in terms of how the illness comes about. So, syempre, kung baga sa laban, no, mas maganda kung naiintindihan natin yung kilos ng kalaban para alam natin kung paano natin pagtatanggol yung sarili natin. So in the same way, for vaccines, to be able to achieve the desired effect, which is providing protection for the patient who hasn't gotten sick yet, kailangan naiintindihan natin kung paano natin kakalabanin yung sakit para alam natin kung paano gumawa ng magandang panlaban. And that process in itself takes a long time. Ngayon, sa susunod pa pati, yung proseso ng pagkakasiguro natin kung safe ba yung bakunang ibibigay and magiging mabisa ba siya, that particular timeline is a fairly long timeline because we need to make sure or we want to observe how people react.
Some countries are also in the final stages of vaccine clinical trials for COVID-19. I think some countries are in phase 3 na, malapit na uh, siyang mailabas. Ano? Is it important that the Philippines takes part in these clinical trials? Meron bang incentive ang Pilipinas para makasali dito? You think na we'll be able to get these vaccines any sooner than any other country pag kasama tayo dito sa trials?
So, that's a very good question, no, Doc Freddy. Kasi alam naman natin na ang Pilipinas, we don't have the capacity right now to create our own vaccines. And so, isa sa mga paraan para mabigyan tayo ng allocation is for us to participate in the trials. Kasi usually, ang nangyayari dyan is pagka sumasali ang isang bansa dun sa mga clinical trials, napa-prioritize din tayo in terms of allocation pagka pwede nang i-commercially distribute yung bakuna. Bakit ganoon? No? Kasi um, sinasabi natin na um, dahil tayo ay nag-contribute dun sa scientific knowledge para maisulong, no, yung pagiging available ng bakuna, marapat lang na mabigyan din tayo ng allocation. Now, the other thing is, kung hindi rin tayo sasali sa mga trials na 'to, malay ba natin na ibang impact or ibang epekto ng bakunang 'to sa atin, bilang mga Pilipino or, being of a different ethnicity, for example, compared to Caucasians or Europeans or maybe people from other ethnicities, no? So nakakatulong 'yun dahil yung mga pag-aaral sa iba't ibang klase at grupo ng mga tao nakakapagbigay ng mas holistic na information base.
Yes, so maraming talagang benefits sa pagsali ng Philippines dito sa mga clinical trials na ito. Dr. Ana, let's continue our discussion by answering questions from our viewers. Meron tayong question galing kay Bella. Ang tanong ni Bella, when do you think we can expect a proven and successful COVID-19 vaccine in the country?
So, Bella, I think one thing we need to understand is that there is no vaccine yet that can claim to be proven. Kasi nga, ngayon pa lang natin inaalam kung ano yung kanyang epekto at kung siya ba ay ligtas, no? So all vaccines now are called candidate vaccines. They're all still subject to clinical trials. May iba na nasa maaagang phase 1 and 2. Merong iba na nandoon na sa phase 3 or parang larger numbers of human participants na siya ang last step bago ma-license ang bakuna. So, dahil wala pa rin naman tayong mga produkto or formulations that are proven, hindi pa natin siguro mapupuntahan yung kailan siya magiging available. Kasi kailangan munang daanan yung pinaka-importanting step which is proving safety and efficacy.
Meron din tayong isa pang tanong galing kay Lawrence. If exhibiting only mild symptoms of COVID-19, would one still need to take the vaccine once we have it?
Ito kasing tanong na ito will really depend on the kind of vaccine that we eventually end up having. Now, kung medyo nasusundan ni Lawrence yung mga bali-balita tungkol sa bakuna, malalaman niya na hindi lang 20 different types. I think at a certain point, they were running about 100 different trials for vaccines, no? So, actually, advantageous yan sa atin kasi kahit sabay-sabay itong mga napakaraming trials, yung mga hindi magiging successful, madali nating matanggal and we end up as a global population with more candidates that can benefit the entire population. So having said that, ang importante kasi is um, malaman muna kung paano gagana yung bakunang yun para sabihin kung anong klaseng population ang mas angkop na tumanggap. So tulad ng tanong ni Lawrence, dapat ba kung mild lang ang symptoms, mabakunahan? Depende nga dun sa ini-expect nating visa at mechanism of action ng bakuna.
Thank you very much, Dr. Ana Ong-Lim, for joining us and sharing important information about this topic. Right now, we're going to take a quick break, but when we return, we'll go back to basics and we discuss safety measures against COVID-19. This is the Doctor's In on CNN Philippines. We're glad to have you with us on The Doctor's In. I'm Dr. Freddie Gomez. Earlier, we discussed the clinical trials that are conducted to find a vaccine. But while we wait, it's important to follow the necessary measures to protect ourselves from the virus. Meron tayong kasamang emergency room specialist in a few minutes, but while we're trying to get our ER specialist guest on with us, let's answer some few questions na galing sa ating mga viewers via the CNN Philippines Facebook page. Marami talaga mga tanong, so I'll take this opportunity to answer some of them. We have a question from Mimi. Okay, ang tanong ni Mimi, what should be the proper course of action if exhibiting mild symptoms? Dapat po ba ay magpa-swab test kaagad? Okay, Mimi, that's a very good question, very practical question. Kapag ang isang tao ay nag-exhibit ng mild symptoms, meron siyang dry cough, probably meron siyang fever, flu-like symptoms, kumbaga, the immediate thing that you have to do is to self quarantine for at least 2 weeks. It is possible to have to take a swab test, within that time frame, ano, habang nagko-quarantine ka. But the most immediate thing, the most important thing that you have to do is to self isolate 2 weeks, and then kahit na even after that 2 weeks, let's say nawala yung mga simptomas mo, balik na naman ho kayo sa normal, ang pakiramdam nyo ay normal, pwedeng na kayo you can even have a swab test after that. Okay? So, to answer that question directly, pwede po magpa-swab test pag meron kayong mild symptoms at ang just to find out kung COVID-19 ito. Yes, you can, but the most immediate thing is to self-isolate for 2 weeks. Okay? So, let's have our guest. Our guest is here and he is ready to go. So, we'd like to welcome Dr. Erick Tiongson. He's an emergency medicine specialist and consultant at the Asian Hospital and Medical Center. So, nice to have you on the show, Dr. Erick.
It's a pleasure to be here, Dr. Freddie. Good afternoon.
Dr. Erick, GCQ na ulit sa ibang parte ng Pilipinas. Let's remind our audience and our viewers once again, what are the safety measures we need to always keep in mind and practice properly?
Well, Doc Freddie, I think we pretty much 5, 6 months into this pandemic, I think we pretty much know what to do, no? Basically, it's still the same. You have to mask, do social distancing, and proper hygiene. That's the core of how to prevent this illness. So we just need to continue to do that. That's all.
Yes, and at dahil nga ang simptomas ng ibang sakit ay parang COVID-19, we need to know when to seek medical attention. What are COVID-19 symptoms we should watch out for at kailan mo masasabi, doctor, na emergency warning signs na ito ng COVID-19?
Well, the difficult part with your regular flu symptoms or respiratory illnesses is that COVID-19 is pretty much the same in the beginning. No, you have respiratory tract infections symptoms like cough, colds, fever. Some report initially decrease in smell and taste. So if you have these symptoms, it's important to have yourself checked by your primary care physician or go to your nearest emergency room. No? So that because the only way to really distinguish COVID-19 is through your PCR test, your swab test, as they say.
Okay, doctor, let's answer some more questions from our viewers. We have a
Sure.
question from Gids. Ang tanong ni Gids, since may bagong strain ng COVID-19, effective pa rin po ba ang social distancing of 6 feet? What do you think,
Yes.
Dr. Erick?
Well, no matter what strain you have, though, even if this strain changes as we go along, the core preventive measures are still the same. The way you prevent this is to distance yourself from the next person, to mask, like I said, and of course hygiene. It will not change, Doc Freddy. It's still the same no matter what strain it is.
That's right. So it's still the same. It's still, no matter what strain attacks us, the basics will still apply. Coming up, let's talk about the essentials we'll need in the fight against COVID-19. You're watching The Doctor's In. Welcome back to the Doctor's In. With the COVID 19 pandemic still looming, it pays to be prepared in case of an emergency. There are a few key items we can stock up on should anything happen. We're joined by Dr. Erick Tiongson, who is an emergency medicine specialist. Doctor, many of us are still at home at para hindi makadadagdag sa hospital congestion ngayon, it's important that you know how to monitor your health. Doctor, what are some of the basic pandemic essentials to have at home just in case?
Well, aside from, of course, your mask and your alcohol and soap, no, at home, you must have your basic over-the-counter medicines for your simple symptoms, like antipyretic for your fever, cold medicine, cough medicine, and if you have respiratory illnesses like asthma, you should have a stock of your inhalers. No? Okay, it's very important if you're entertaining yourself to have COVID, try not to use the nebulizer at home because it just spreads the virus that way. No? It aerosolizes the virus, so it's better to have your inhalers with you. And of course, it wouldn't help to have your vitamins with you, so at least you can boost your immune system.
Okay, you mentioned some equipment at home, such as a nebulizer, where sometimes it just spreads the virus, the COVID 19. And one another gadget that a lot of people ask me about is the use of pulse oximeters. A lot of people are still in debate whether they need this. Is this really worth the money to get one? Could you explain to us, Dr. Erick, what is a pulse oximeter and is it useful in helping to monitor or fight COVID 19?
Well, the pulse oximeter just shown in the screen right now is a gadget that measures the oxygen content in your blood. Okay. In the past, these gadgets are very expensive, but if you go to your online stores right now, you can actually procure some of these pulse oximeters at a very reasonable price. But we don't really advocate using this just for anybody. No? If you have a patient who is a high risk patient, some of our elderly patients with respiratory illnesses, it would benefit you to have these pulse oximeters at home, as they can guide you on whether to take the patient to the hospital or not. Anybody who has oxygen saturation lower than 94% on room air, breathing normally, should be brought to their medical healthcare provider. So if you can afford it, sure, it's a nice thing to have at home. But the basic thing to make sure and remember is that if you have difficulty of breathing, pulse oximeter or no pulse oximeter, you must go to the hospital. You must go to your emergency room.
Okay, that's good advice. So a pulse oximeter is nice to have if you do have it, but it's not an essential part that everyone should go out and look for. But what if you don't have a device such as that, a pulse oximeter, or maybe even they don't even have a thermometer at home? Anong dapat gawin ng mga viewers natin? What should they look out for? How can they be prepared for any emergency that might happen?
Okay, well, basically, it's common sense. If you don't feel good and you really feel bad, and you can't eat, and you have difficulty of breathing, no matter, you don't need these things, you don't need these gadgets. Bring yourself to the hospital and let your healthcare provider assess you and see if you really need to be in the hospital or not. But if you feel okay and you feel, you have these little cough, colds, and little minor aches, then it would be best for you to stay at home. That would be the best thing to do.
Really quick, Dr. Erick, what are some practical tips that you can give our viewers when caring for someone with suspected COVID 19 at home?
Well, of course, you have to protect. If you're caring for somebody with COVID 19 or suspected to have COVID 19, you must protect yourself first and foremost. You don't want to get that disease, okay? You don't want to get that illness. Make sure you have with yourself the number of your nearest ambulance who can take you to the hospital, or a relative who can take you to the hospital. And make sure you have the numbers of your local hospital that you can call immediately for help. For Asian Hospital, you can call our trunk line, 8771 9000, or you can call us for e-consults or online appointments at our website, www.asianhospital.com.
Now let's check some of your questions online. We have a lot of questions coming in. We have one from Shella. Shella's question is, does temperature checking really help monitor COVID-19 infection?
Well, the assumption is you're taking your temperature correctly. A lot of a lot of people right now have these handheld thermometers, the digital thermometers, and sometimes they're not really checking their temperature well. So make sure you read the instructions in your thermometers and make sure you take the temperature well. If you have fever and it's just fever, that's the only symptom you have, you can actually treat this at home and stay at home, and you'll be better off there. No? But yeah, there's a valid use and a very good use for temperature checking, but you have to make sure that you are taking your temperature correctly.
I think one of a common question I also get from some of my patients is, how is the current situation now when it comes to hospitals? A lot of us are really trying to do all of this, trying to stay at home, trying to stay away from the virus to helpfully keep those hospitals up and running, to not overwhelm them, to keep the patients coming in and being treated correctly. So, Dr. Erick, let me ask you, what's the current situation there in your ER department? Is it still as bad as it was a couple of weeks ago or even a month ago?
Well, I think you see it in the news, just like any other hospital in the metropolis or in the Philippines. People are scared, and definitely when they're scared, they flock to the emergency room. And this illness right now is not like your regular illness where the turnaround time is very, very fast. No, when patients can be discharged within a week. Sometimes nowadays patients stay for weeks, 2 weeks to 3 weeks until they get better. So we are crowded. I will admit that the emergency room is crowded with backlogs of patients waiting to be brought up to the floors. So the best thing really for everybody is, if you don't have the symptoms that I told you about a while ago, where you have difficulty of breathing and really weakness, where you can't eat or can't sustain yourself well, please stay at home. There are a lot of ways where you can consult a doctor, like I said, through e-consults or online consults. You'd be better off served there. Now, but if you have any difficulty of breathing, or you feel different, and you really can't stay home, then I would suggest that you try to find a hospital that can accommodate you. But right now, we're still quite full, unfortunately.
Thank you very much, Dr. Erick Tiongson, for all your help as a frontliner and for joining us and answering some questions today. And to our viewers, thank you very much for watching and joining in with your questions. Remember, let's all work together to fight COVID-19. Let's practice proper hand washing, social distancing, and wearing face masks and face shields. I'm Dr. Freddie Gomez. Stay safe, everyone.